One senior official inside the CDC says they told the White House about the virus's rapid spread across Europe, but that the White House was extremely focused on China and not wanting to anger Europe, even though that's where most of our cases were originally coming from.
More and more members from the Centers for Disease Control and Prevention are speaking out regarding Donald Trump's treatment of healthcare professionals, medical professionals, scientists, individuals who are, the actual experts in how to appropriately respond to this pandemic and how to keep people safe so they don't contract this deadly virus. And what the CDC workers have told the press is that they feel that politics comes before doing the right thing and keeping people safe during the pandemic. That's how the Trump administration has treated this. They also share with CNN a number of other issues pertaining to censorship by the Trump administration. Let's watch.
Spoke to 6 current CDC staff members, and many of them say the White House has stifled the CDC in its coronavirus response, and at times limited its ability to provide health information to the public. One source telling CNN, "We are working under a black cloud of an administration that doesn't have our backs." Another saying, "We've been muzzled."
So, John, they say they've been muzzled. I mean, this isn't surprising news for anyone who's been following Trump's treatment of the CDC. Just keep in mind that they had previously attempted to release guidelines on how to reopen the country in a safe way. And Trump decided to shelve those guidelines because for him, opening the country up prematurely is much more important than doing the right thing and keeping people safe. But what do you make of this? I mean, I love that they're speaking to the press, but will there be any type of positive outcome from this revelation?
I mean, hopefully. One of the reasons I think that Rick Bright's testimony seemed to matter so much was we want outspoken people on the inside who are revealing what's going on that are only in it for saving lives, for the science. People don't go to work at the CDC because they're hardcore partisans. They go there because they want to help out in situations like this. And they'll serve under multiple administrations, and sometimes Republican, then Democrat, then Republican again. And it must be incredibly frustrating on a daily basis to know that decisions are being made without any reference to the advice of the people best trained in the entire world to get us through the situation. That's got to be incredibly frustrating to know that if you were to speak publicly, you would likely be fired. You'd be pushed out. And even when you do it in a restrained way, like with the guidelines that you referenced, that it's probably going to be censored. Imagine, it must feel like you're under, some other regime, that surely this can't be the United States. This has got to be something else where they will stop you from speaking out. They won't take your advice. They're just going to leave it up to the governors in all of these cases. That has got to be so incredibly demoralizing. And they're probably talking to people who feel a little bit more secure, a little bit more senior, still anonymous. But imagine if you're at the lower levels of the CDC or you're thinking about getting involved in something like this. How demoralizing about the future of your career must this be? I mean, we've faced sort of a version of that in terms of media, about seeing, who gets pushed, what sorts of messages are allowed, how resistant people are to inconvenient truth and things like that. But in medicine, it's obviously much higher stakes, and to see that what studies show and the evidence doesn't matter at all, that they've decided based purely on either political metrics or on Wall Street, it's all driven by that. And I can't imagine what it must be like to be working at the CDC right now.
I mean, just to buttress your point about how everything is business driven for Trump, just today, and we're so overwhelmed with news stories every day that it didn't make it in the rundown today, but our viewers should know, just today, Trump signed an executive order deregulating, basically repealing a number of industry regulations in order to help the economy, stimulate the economy, because at the end of the day, that's all he cares about. Because the success of the economy means that it's more likely that he could get reelected. His own investments would do well. Donald Trump, again, looks out for Donald Trump. And I think the point that you made earlier in the show today about how he asked some of his advisors whether we can just let this virus wash over the country and kill people and then just be done with it. That's the way he thinks. He doesn't really care or value human lives. And the CDC, like, I'm glad that they're speaking out, and I'm glad that they're doing so anonymously. Like, I think it's usually better for a news story to have like actual named sources, but I can understand why they would speak to the press anonymously, because first off, you need to have experts doing the hard work. And I'm glad that they're not about to get fired because they finally like spoke out publicly against Trump. And secondly, like, Trump would be brutal. I mean, the stuff that I'm seeing about Dr. Rick Bright right now in conservative media is disgusting. And all he wanted to do was avoid encouraging people to use a drug that could lead to long-term health ramifications and heart problems.
Yeah. Well, and I sort of almost can understand. Trump hates Bright, so it's going to be like piranha. They're going to be destroying him. But they're savaging Fauci on a daily basis, even on Fox. Trump still ostensibly accepts Fauci. He's kept him in the position, but because what he says is inconvenient, they're attacking him brutally. And these are people that have been around for a really long time. Again, if you're not even that senior, you must know that if you were to speak openly. If you were a mid-range CDC researcher that did an on-camera interview on Chris Cuomo tonight, don't bother going back to work tomorrow. It's not going to happen. You would be immediately gone. Best case scenario, they bring you in to testify once, but your career is probably still over, at least as long as the Republicans are in charge.
Exactly. And just to quickly go over a few of the guidelines from the CDC in terms of how to do social distancing safely and how to reopen responsibly so people don't get sick and die. Even though the Trump administration refused to release those guidelines, the CDC did quietly release it themselves over the weekend. And here's what we've learned. For instance, as restrictions across the country on restaurants and bars ease, the CDC recommends owners give workers at a higher risk of getting sick a job that limits the person's interaction with customers. I mean, this is just common sense. So if you have an employee who is more likely to contract the virus just due to the nature of their job, maybe keep them away from a giant volume of people, right? Like, it's just common sense. Like, the fact that the Trump administration was against, releasing this to the public is just sick. Here's some more. When mass transit resumes its full service, the agency recommends being prepared to adjust routes based on the different levels of virus spread and to coordinate with local health officials about prevention strategies such as wearing a face covering, which has somehow become a controversial and divisive topic in the United States. For businesses that provide childcare during the pandemic, the CDC recommends having plans in place, for example, to have substitute workers if staff members are sick and requiring staff and children older than 2 to wear face coverings. This is the kind of information that the Trump administration censors while simultaneously encouraging you to take a drug that has not been proven as a treatment for coronavirus and could lead to severe heart problems and death. Yeah. That's the leadership we have.
Yep. And now on that, now there are others saying that they're taking it too, because that is how you demonstrate loyalty in a death cult. You actively participate in the incredibly ridiculous, irrational things that the cult leader demands.
I don't believe any of them. Not a single one of them. They're not going to risk their lives. They know what the risks are. I don't know.
I hope they're lying.
Look, honestly, on a personal level, I don't care. Like, if all these right wingers are legitimately taking hydroxychloroquine because they're idiots and they think that it's smart to take something that hasn't been medically proven as a treatment and could actually kill them, I believe in liberty. Do you? The problem is encouraging average Americans to do it, and they don't know. I mean, some people might actually panic and think maybe this is a good idea. The FDA has said it is not a good idea. Multiple clinical trials have indicated it is not a good idea. Please, for the love of God, listen to the actual experts here. And for right-wingers who think it's a good idea, again, do you, but don't go around encouraging other people to take something that could really harm them.
Thanks for watching The Young Turks. We really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.